Some new developments in New Jersey. The governor has just declared a public health state of emergency in the Garden State. This comes after the number of COVID-19 coronavirus cases in New Jersey has nearly doubled, with officials announcing 5 new infections today. Eyewitness News reporter Cleve Bryan is live at the New Jersey Regional Operations and Intelligence Center, where a press conference was held earlier this afternoon. Cleve, what's the latest?
Natasha, just 5 minutes before 6 o'clock, the governor issued that emergency declaration for all 21 counties in New Jersey. This essentially frees up resources that may be able to flow through the state, through state agencies to affected communities. This, as just earlier this afternoon, officials were warning the people of New Jersey to be prepared for possible exposure as the coronavirus continues to spread. Describing the largest daily jump in COVID-19 cases to date, New Jersey health officials announced 5 new presumptive positive test results Monday, bringing the total number of cases in the state from 6 to 11.
The fact that we're continuing to see additional cases is concerning, but it is not unexpected. It follows the trend that we're seeing around the rest of the country and, in fact, the world.
The 5 new cases are in northern New Jersey, but there are new developments in the 1 positive case in South Jersey. Last week, officials said a man in his 60s went to the Cooper Urgent Care on Marlton Pike in Cherry Hill and was later admitted to Jefferson Hospital in Cherry Hill. Officials say 4 employees from the urgent care are now under home quarantine for 2 weeks. Several people in the waiting room were also notified, but officials say they do not need to quarantine themselves because they were not in close proximity to the man.
I know that the urgent care centers were all notified and that they undertook their own notification of not only their healthcare workers and people that were in the waiting room when this case was in the waiting room.
State health officials say the community spread of the coronavirus is still not established, but they are warning the public to have enough food and medication for 2 weeks should you come into contact with a patient and need to self-quarantine.
Self-quarantine and social distancing are important public health measures.
And state officials say they want to be clear. They are not encouraging people to make a run on grocery stores to stock up on bottled water, toilet paper, things of that nature. They're just encouraging everyone to have a little bit more non-perishable food in their pantry should there be an incident where they need it. Also, they say as far as schools, that will be up to individual school districts at this point, whether or not they want to close any of their buildings. We're live in Ewing Township. Cleve Bryan, CBS 3 Eyewitness News.
All right, Cleve, thank you very much. Now,